Hey everybody, Dr. Khan here from OKC Fertility. I'm going to do a super quick video today about IVF or in vitro fertilization, just to go over a little bit about the premise, kind of the steps, some things we look out for, some general recommendations. So IVF is one of the procedures that we include in the umbrella of ART or assisted reproductive technology. And that's really any time that we're taking gametes, that's eggs and sperm, out of the body. So with IVF, what we're doing, the first part is there's lots of logistical work, there's lots of paperwork, prep work, making sure everything's ready. And then when the actual time comes to start the process, we use gonadotropins for controlled ovarian stimulation. Gonadotropins are usually FSH and or LH. And what we do is we start out giving those patients injections, and you'll take injections for a certain number of days, and your doctor will be reviewing blood work and ultrasound. You'll usually be going in fairly frequently to monitor how the follicles, so all the individual little containers that house each egg in the ovary, are growing. We really want to ideally get every hormonally responsive egg in the ovary at that point to grow to maturity. And so usually that's about, it depends, 10 to 15, sometimes a little bit longer depending on the protocol, days of injection medication. And then when the team decides it's the right time to trigger, you will take a form of trigger shot, and that's usually HCG. It's sometimes LH, again, depending on the protocol, and I'll talk about that in a second. And then about 36 hours later, you undergo an oocyte retrieval, and so you go under a light sleep. Usually you don't need a breathing tube, just oxygen in the nose. You usually will have an anesthesiologist or a CRNA present monitoring your breathing during the procedure. It's all done vaginally under ultrasound guidance, and really we just go through usually the back wall of the vagina into the peritoneum, so the sac that holds all your ovaries, and just take a tiny needle into the ovary and just try to aspirate or suction each individual egg out of those containers. They immediately go to the lab where they're cleaned and prepped for fertilization. Fertilization usually takes place in one of two methods. Either it is conventional fertilization, where eggs and sperm are just incubated together and fertilization sort of occurs more naturally, if you will. Or alternatively, we do something called ICSI, or intracytoplasmic sperm injection, where one sperm is injected into an egg and is sort of a first fertilization. And sometimes that's a good option for a couple, and that really just depends on lots of different factors that you discuss with your team. So after fertilization, we watch the embryos, we monitor how they grow in the lab, and usually we check on them to make sure that they fertilized and to see how many fertilized. We check on day 3, and then we usually will do a check on day 5. And then those milestones are really important, just depending on what your plan is with your team, whether that's a day 3 or day 5 transfer, or whether you're going to do genetic testing of your embryos, and that's usually on day 5 or day 6. So that's just the whole process in a nutshell. There's different protocols that different doctors use. Sometimes they'll use an agonist protocol, or sometimes they'll use an antagonist protocol. And those are really just ways to control your ovary and to control the timing of your ovulation during the IVF stimulation process. And it really ends up being a question of just what a particular provider is comfortable with and what they think is the best thing for the patient at that time. So much literature goes into trying to decide what's better or worse, but they both really are great protocols when used correctly, and pregnancy rates are really excellent with both. One thing that I always like to talk to patients about is just this natural attrition that happens with embryos. So we have a certain amount of eggs collected, let's just say 10 for argument's sake, and of that 10, only a certain number are going to fertilize. Of the embryos, the eggs that fertilize, only a certain number are going to make it to day 3, only a certain number are going to make it to day 5, only a certain number that are biopsied are going to be genetically normal. And so if you start with 10, often by the end you're sort of left with 3 or 4, and that's really a normal process, but people just need to understand that going into it, because if you really are thinking, oh, well, if I got 10 eggs, I'm going to have 10 embryos, that's just not always the reality, not often the reality. Whenever we're doing controlled ovarian stimulation, we really like to keep a close eye on estrogen levels and how patients are feeling, because we really do have to look out for something called OHSS, or ovarian hyperstimulation syndrome. That is a condition where basically, because of the hormones that the body is exposed to, you get basically a syndrome of vascular leakiness. And it can be fairly dangerous. The fluid comes out of the vessels and goes into the third space, so people have swelling, people have fluid in their peritoneal cavity around their ovaries, and the fluid is not in their vasculature, so the blood becomes thicker, and patients are more likely to have complications from having the blood being thicker, like strokes and things of that nature. They're very rare because we've learned so much in the time that we've been doing IVF, but it's obviously something that doctors are very cautious with, and we're always on the lookout for that, and really always trying to prevent rather than treat, and always trying to make sure we're mitigating. So we're really trying to keep your estrogen level in a safe place. We might be adding different things to your protocol to try to keep you safe if we're worried that might be something that might happen to an individual patient. So that is just IVF in a nutshell. I would love to answer any questions that anybody has. Otherwise, look us up, okcfertility.com, or follow us on Facebook or Instagram. We would love to hear from you and hopefully help you. Thanks, guys.